Welcome back to Prime Live Ramadan edition. With World TB Day marking a significant moment in the fight against tuberculosis, the South African National AIDS Council is leading the charge with a powerful keynote address delivered by Chairperson Deputy President Paul Mashatile in KwaZulu-Natal. Making a national call to action, the End TB campaign, launched at Ugu Sports and Leisure Centre, aims to galvanize leadership and individual commitment towards ending the devastating impact of tuberculosis in South Africa, with a targeted focus on case finding and linkage to care. Joining us this evening is Dr. Tembisile Tsulu, Chief Executive Officer of South African National AIDS Council, for a discussion on the campaign's implementation. Good evening, Doctor, and welcome to the show.
Good evening, and good evening to your viewers. Thank you so much for having me.
Doctor, we kick off by setting the scene and sharing some context with our viewership. In a very simple manner, can you explain what is tuberculosis and why it remains a major public health concern in South Africa?
So tuberculosis is a bacterial infection. It's caused by a small bug or bacteria called Mycobacterium tuberculosis, which was discovered in 1882 by a scientist called Robert Koch. It normally affects the lungs, but it can affect any other part of the body. It's spread through coughing or sneezing, so it's in the air that we breathe. And the reason why it remains such a problem in our particular country is that we are in one of the top 30 high burden countries when it comes to TB. We are also in the top 10 countries when it comes to TB, TB-HIV co-infection, as well as multi-drug resistant TB. We also see a lot of delayed diagnosis when it comes to TB, and there are a lot of socio-economic factors that are associated with TB. And South Africa is a country of high inequalities, poverty, malnutrition, and that is why it remains a public health crisis in South Africa.
So, Doctor, as you've outlined some of the contributing factors to South Africa being ranked where it is in terms of TB, how does SANAC aim to address potential barriers to accessing TB testing, especially in these underserved communities and amongst vulnerable populations?
So TB is highly contagious and very deadly, and quite deadly, especially in people living with HIV. So what the minister has launched today is the End TB campaign, where we aim to test 5 million people every year with an aim of finding a positivity rate of 5% so that we reduce not just the new infections, but also the mortality. So the aim that SANAC is doing is that we are bringing all stakeholders together, and we are saying, one, if you are a person that is diagnosed with TB, please allow us into your household so we can test your family members who are your close contacts, so they can either get access to treatment if they have TB, or they can get access to TB preventive therapy so they don't contract TB from yourself. We are also requesting every person that has had TB before to allow us to retest them to make sure that it doesn't recur, because TB is such a common infection in South Africa. And then we are also asking every person living with HIV to come forward and test for TB, because there is a relationship between HIV and TB, but it doesn't necessarily mean that if you've got TB, you've got HIV.
I think that's very important that Doctor points this out, that it doesn't necessarily mean that if you've got HIV, you've got TB. Doctor, you mentioned the ambitious goal of testing 5 million of our citizens annually as a means of achieving the goals of the End TB campaign. What type of collaboration will be required between various stakeholders, the government, non-governmental organizations, and community groups, so that we may be able to achieve this very ambitious goal?
So we as SANAC are the highest decision-making body when it comes to matters of HIV, TB, and STI policy in the country. So we bring together private sector, government, all government departments, the development partners, as well as civil society. And these are the partnerships that we are going to lead. We are going to need the media, for instance, to work with us to spread the news around what I was saying, that TB is still a cause for concern in this country, and yet people seem to have forgotten about it. Nobody talks about TB anymore. Post-COVID, we've all just gone into a lull, and yet TB is still the #1 infectious cause of mortality in the country. We need partners like the Department of Social Development that funds NGOs that are going to go into communities to try and find these particular patients. We need partners that are going to go into communities to find the men, because we know that the communities that we're looking for particularly are men, we are looking for young people, and we are looking for children. And these people are sitting at community level where communities need to assist us, even through traditional leaders, to make sure that the message is spread so that the stigma is reduced in order for people to come forward for testing. Partners like the Department of Basic Education, where scholars and young children are, we want to be able to test there. The Department of Transport, the taxis need to be ventilated well enough. Human settlements, I could go on and on because we need good ventilation. We need the private sector, people who are on medical schemes, to be able to be tested for TB, because there are very, very little people that are actually tested for TB in the public sector. And as soon as you are, in the private sector, and as soon as you are found to have TB, you are referred to the public sector. We need our communities to actually help us as the health sector to come together and to make sure that we conquer and we end TB as a public health threat by 2030.
So, Doctor, in one of your earlier responses, you mentioned multi-drug resistant TB. We know this is a growing concern in South Africa. Does the End TB campaign have a plan to address particularly the issue of multi-drug resistant TB?
Absolutely. I think if you consider the fact that multi-drug resistant TB develops when, one, you contract TB that is drug resistant, mainly when your immune system is low, or if you start taking treatment and then you stop, and when by the time you come back, you've become resistant to the drugs that are normal. So part of the pillars that we are going to follow as we test the 5 million is, one, a strong communications and advocacy campaign. We want to make sure that we find and we link the missing patients, especially the ones that have fallen off treatment, that were on treatment before, because they are most likely to develop resistance. We want to make sure that we retain patients on treatment and in care to make sure that they complete their treatment. And once they've completed their treatment, we want them to come back every 6 months for us to be able to do chest x-rays, because it's no longer sufficient for us to just ask, are you coughing? Are you coughing blood? Are you losing weight? Do you have chest pain? Because many people no longer have symptoms. You only find the TB actually when you do the actual chest x-ray or the gene expert test. So the ways that we are using is to make sure that people stay on treatment, and the government is also assisting through social development to make sure that people that have got TB get access to social grants, because malnutrition and poverty is a factor. But the key thing is to make sure that there is self-sufficiency and that people are able to be well educated to raise awareness so that they come forward to test and to access treatment before they develop actually drug-resistant TB.
So, Doctor, you've also referenced to us the different levels of engagement and collaboration that you and the team at SANAC will be championing between governmental, non-governmental, community-based organizations, etc. But if there were a call to action for the average citizen who's tuned in today, and naturally on the many interviews that you'll be fielding over the coming days, what would that call to action be in us wanting to move the responsibility or share the responsibility between government and authority and the average citizen?
I would actually make a call to action which is aligned to the campaign tagline. It says, yes, you and I can end TB, commit, invest, deliver. And when it says you and I, it means it's an individual accountability level where you need to wake up today, go and have your TB test, because TB is so highly prevalent and it is so deadly that if you don't test, it will be sad for somebody to die of a preventable and a curable disease. So the challenge is on each and every individual to go out and get a TB test today.
Thank you, Doctor, for your time this evening, and naturally that call to action heeded by all of us to dovetail with the tagline of the End TB campaign. We wish you well this evening, beloved.